Good morning. We are very happy to have Dr. Spurgeon, Associate Director of Bangalore Baptist Hospital, to give us a talk on diabetes. Dr. Spurgeon completed his MBBS and MD from Andhra Pradesh and later did his endocrinology from CMC Vellore. He is presently working as consultant endocrinologist in Bangalore Baptist Hospital. He is also part of the BBH Administrative Committee as Chief of Medical Staff and Associate Director. He is also a parent of our school. On behalf of the Board of Management, Principal Dr. Jerry George Matthew, staff and students of Clarence High School, I extend a warm welcome to you, Doctor. Before I hand over to Dr. Spurgeon, let me inform you that if there are any queries, you are most welcome to send it to safe.place@clarencehighschool.in. safe.place@clarencehighschool.in. We will send the queries to Doctor, who I am sure will be happy to respond to them. Now let's sit back and listen to Dr. Spurgeon. Thank you. Over to you, Doctor.
Thank you so much and good morning, Sarah Korean. And thank you, Clarence High School, for giving this time to be able to share some of the insights and knowledge about the most common illness that we come across every single day. I'll be talking about diabetes. Before that, let me just share the screen with you. Just give me a second. I'll be talking about diabetes to see, how we'll be able to manage, because most of the, families, they'll be having one or two people who are affected, or as their distant relatives who are affected with diabetes. Now we'll start. What is the definition of diabetes? It is basically a group of diseases. It is characterized by high blood glucose concentrations, resulting from the defects in the insulin secretion or action, or both of them. Remember the fact that whatever the food that we eat, it is basically having carbohydrates, proteins, and fats. And when we take these, carbohydrates, proteins, and fats, they get digested and they get metabolized. These carbohydrates they be ultimately turned into glucose, and this glucose has to enter into the cells to generate the energy for us. But if the person is having diabetes because of the insulin deficiency or else because of the defect in the insulin action, people tend to have high blood sugars in their blood, and this is not good for them. Now, predominantly, there are two types of diabetes. The first one is the type 1 diabetes, which was commonly called as insulin-dependent diabetes mellitus. And the most common variety is type 2, which constitutes around 90 to 95%. However, there are other kinds of diabetes like gestational diabetes mellitus, which is generally seen with pregnant women. They generally develop this once they're around 24 to 28 weeks of gestation. And there are other conditions like prediabetes, which is a prelude for the development of diabetes. And there are some other forms of diabetes like secondary diabetes and pancreatic diabetes, and various genetic causes are also there. Now, type 1 diabetes, as I have mentioned to you earlier, it is generally seen with children, school-going age group, less than 20 years. And the common cause for this is it could be either immune-mediated. Basically, the antibodies will be there in our body and they try to act against the beta cells and they will destroy the beta cells. And remember, beta cells are the one which will produce insulin in our body. And sometimes it could be idiopathic. So this is generally seen in children less than 20 years of age. The other common variety, as I have mentioned earlier, is type 2 diabetes, accounting for 90 to 95% of the diagnosed cases. Now, here, There is a combination of insulin resistance and the beta cell failure. And remember, this is not a static disease. This is a chronic disease, and this is also a dynamic disease. It basically progresses over the years if you do not take care and control this one. And pre-diabetes is a prelude. This is not the normal state or not the sugars are in the diabetic state. You have two terms, what you call as an in-phase fasting glucose, where the fasting plasma glucose is above the normal range. Now, normal glucose, the plasma glucose for anyone, they should be less than 100 milligrams per deciliter. So that is the normal fasting plasma glucose. And if the fasting plasma glucose is more than 126, you will say that the person is having diabetes. But these are the group of people where the sugars are ranging between 100 and 125. You call them to have, you call them as in-phase fasting glucose. And there is also another term, what we call as in-phase glucose tolerance, where the sugars after the glucose load are the post-prandial sugars, they will be between the normal and the diabetic range. The reason why this condition is very important, it is a trigger, it is a signal, it is now triggers you and tells you that there is a possibility for you to develop future diabetes so that you'll be able to take care and control and go to the healthy lifestyles so that you'll be able to prevent or delay the onset of diabetes. And therefore, this condition should be taken with caution. Now, tell me what are the symptoms, how they present. The most common triad is polyuria, where people, they tend to pass more urine because of the high osmotic, high osmotic pressure in the blood. And the second thing is polyphagia, because they are losing glucose to the urine and the cells are starved of the energy, ATP, they continue to be hungry and therefore they tend to eat more. And because of the osmotic pressure is more, osmolality is more, they will have increased thirst and therefore they try to drink lots of water. But however, remember, majority of the people who have diabetes, they can be asymptomatic for many years. And therefore, it is important for us to be aware if there is a family history of diabetes, or else if we have any risk factors, we better screen every year with our blood sugar, and that is the only way how we will be able to diagnose this condition. On the contrary, type 1 generally it presents in an acute manner, and as I mentioned earlier, it is commonly seen in children less than 20 years of age. They generally present with diabetic ketoacidosis. That means the sugar levels will be very high. Because the body is not able to use the glucose, what happens is that the fat in the body is broken down and that will generate the acids. You will have the acetone formation, that is a ketone body formation, and there is also acidosis. This is the common presentation of type 1 diabetes. Now, what are the other symptoms that they can have when they have type 1 diabetes? Generally, these people will have the osmotic symptoms like polyuria, polyphagia, and polydipsia, and they will also lose a lot of weight either within few months or within few weeks duration. So, if they have lost weight and if they have these osmotic symptoms like increased urination, increased dietary intake, and increased thirst, they need to screen for sugars, and this is how type 1 diabetes can manifest. Now, metabolic syndrome, it is a conglomeration of the minor abnormalities in our body. There can be high insulin levels because of the insulin resistance. There can be abdominal obesity. They can have abnormal lipids like elevated triglycerides, and low HDL cholesterol, which is a good cholesterol, and they can have the hypertension. They can have, bits and pieces of gene combination, and this is also important because it is a risk factor for future heart disease and as well as diabetes and glucose intolerance. So these are the things that we need to need to be kept in mind. Now, how do we diagnose diabetes? This is not a clinical diagnosis. It is not the diagnosis diagnosis that we make it with our clinical examination or else the symptoms that the patient are having. It is basically a biochemical diagnosis. Now, if the fasting plasma glucose, if it is more than 126 milligrams per deciliter, or if the postprandial glucose, 2 hours after a meal, or else, 75 grams of anhydrous glucose, loading, if the sugars are more than 200, or else, if the sugars are the average sugars, what we call it as a glycosylated hemoglobin, HbA1c, if it is more than 6.5, if you have any of these abnormalities biochemically, either increased fasting plasma glucose more than 126, or else the postprandial glucose more than 200 milligrams, or else the 3 months average glucose glycosylated hemoglobin more than 6.5. If you have any of these things, we label them to have diabetes. Now, who are the people that need to be screened? Because I told you it is can present without any symptoms, and it cannot be diagnosed based on the clinical symptoms. Therefore, we need to screen the patient. We need to go for the testing in case we have any of these risk factors. So testing should be considered if the people are overweight or obese. Remember, if the BMI is more than 25 kg per meter square, you call them to have overweight. But in the Indian context, the Asians, the cutoff for the BMI to categorize as overweight if the BMI is more than 23 kg per meter square. Okay. Now, obesity we call if it is more than 30 kg per meter square, but in the Asians, the cutoff is 27. So, if you are obese or overweight, based on your body mass index BMI. And if you have any of these risk factors, you need to screen for diabetes. If you have a first degree related with diabetes, or else if you are in the high risk rate, or definitely Indians and Asians, they come under this category of high risk race and ethnicity. Or else if there is a history of cardiovascular disease, or if you are having hypertension, or else if your little profile shows the good cholesterol level is less than 35 and the triglyceride level is more than 250 milligrams per deciliter. Or else in case of women, if they have a polycystic ovarian syndrome, or if our lifestyle is, a sedentary lifestyle, or if we have other clinical conditions associated with the insulin resistance, like, severe obesity or the acanthosis nigricans. Now, these are the people they need to go for screening or the testing for the sugar levels. Or else, patients with pre-diabetes, if the glycosylated hemoglobin level is ranging between 5.7 and 6.4, the normal glycosylated hemoglobin level should be less than 5.7 in a normal individual. Or else, if you have borderline sugars, as I have mentioned, the fasting sugar between 100 to 125, or else postprandial sugar ranging between 140 to 199. That time, if you have these things, then you need to go for yearly testing. Or else, if you're having gestational diabetes, which is a condition specific to the pregnancy, then you need to have the testing or the screening for the sugar lifelong, because that is a trigger, that is a predictor for the future development of diabetes. And all patients, testing should begin at the age of 45 years. If the results are normal, testing should be repeated at a minimum of 3-year intervals with consideration of more frequent testing, depending upon the initial results and the risk status. So if you fall into any of these categories, having overweight or obese, and if those risk factors, or if you have pre-diabetes, if you have gestational diabetes, age more than 45, then you need to go for screening at a minimum of 3-year intervals, and depending upon other conditions, you need to go more frequently, at least once in a year. Now, how about the young children, or else, the school-going people in their teens? Okay, testing should be conducted in youth who have more weight. Again, this is based on the BMI. More than 85th percentile or obesity more than 90th percentile. And along with association of these risk factors, if there is a maternal history of diabetes, or else, when his mother had diabetes, his or her, mother had diabetes during the child gestation, or the family history of type 2 diabetes in the first or the second degree related to race or ethnicity high risk, and signs of insulin resistance are conditions associated with insulin resistance. Now, what are the conditions that are associated with insulin resistance? Okay. Now, for example, women are the school-going children if they have polycystic ovarian syndrome, where they can present with irregular cycles, they can have excessive facial hair over the face or the body, and they are overweight or obese. They are prone for developing diabetes, and they need to be screened. Or else if they have insulin resistance, what is the clinical marker when you look at an individual to say whether the person is having insulin resistance or not? If you look at the neck, if there is a black or the velvety pigmentation, with skin test, you generally call it as acanthosis nigricans. That is a physical marker to say that you have insulin resistance, and there is a possibility for you to develop type 2 diabetes in the future. If you have any of these things, you should also go for screening for sugars. Now, how do we manage diabetes? The first thing, if you are diagnosed with diabetes, you require a thorough evaluation because diabetes is associated with multiple other comorbid conditions. Second thing, you need to go for the medical nutrition therapy. That means there should be some change in your dietary and the eating habits. Third thing, exercise is very important. Fourth is medication. And the fifth and the most important, I would say, among all these things is monitoring regularly with your doctor. Because diabetes is not a static disease. It is a progressive and it's a dynamic disease. It changes. There is a possibility of developing complications involving every system in your body. And therefore, once you have diabetes, it is very important to follow up with your doctor on a regular basis. Make the decision, looking at the patient, keeping the patient in the center, and then try to work around. We need to assess the comorbid conditions because people with diabetes, they can have blood pressure, they can have abnormal cholesterol levels, they can have, coronary artery disease. There are many other complications that can develop with diabetes. So there need to be a thorough assessment and the comorbid conditions when you have diabetes. And we also need to look into the lifestyle of the patient, need to have a baseline assessment of the physical activity, the dietary habits, and the various other things, so that you'll be able to give a comprehensive care, for the management of diabetes. Now, for the people who are having pre-diabetes, as I told earlier, pre-diabetes is a prelude for the development of future diabetes. So if you have pre-diabetes, or else if you're fitting into the overweight or the obese category, and with many of the risk factors in your family, like maybe the maternal history of gestational diabetes, or the first or the second degree relative having diabetes, you need to be very mindful about your lifestyle so that you'll be able to prevent the onset of diabetes, or else you'll be able to delay the onset of diabetes. This is very much important. Diabetes is not because of one single risk factor. It is because of multiple risk factors like sedentary lifestyle, physical inactivity, genetic background, strong predilection to have diabetes because of our genes, because of the abnormal lifestyle, the dietary habits, and the stress that we carry on. So it is a it is a multifactorial disease. There are some modifiable factors. There are some, factors which we cannot modify. For example, the genetic makeup that we are having, we cannot really change that one. We carry that risk throughout our lifetime. If both the parents are having diabetes, there is a possibility of 60 to 80% for the children to develop diabetes. So that genetic background, that genetic makeup will not be able to change. But there are some modifiable factors like the physical inactivity, taking stress upon our heads, and the dietary pattern that we take, the exercise that we can do. These are all the modifiable risk factors. So we need to concentrate on these things, looking at our physical activity, looking at our diet habits, so that we'll ultimately be able to prevent and delay the onset of diabetes. If you look into the current scenario, there was a study that was made in Vellore when I was there, studying. We looked at the prevalence of the pre-diabetes and diabetes among the school children. It was a startling, discovery. Approximately, 10% of the school-going children, they were falling into the pre-diabetes category. And remember, if they do not change their lifestyle and they continue to live and manage with the same lifestyle, there is a potential possibility for them to develop diabetes. And therefore, it is important. We need to be mindful in preventing and dealing with the onset of diabetes. Achieve and try to maintain 7% loss of initial body weight. This works wonders. So there is definite reduction in the development of the future diabetes, and then also the physical activity at least 150 minutes per week. Apart from the lifestyle modification, sometimes we might even advise metformin therapy for the prevention or the delay in the onset of diabetes. But remember, lifestyle modification with dietary modification and the intense physical activity is much more effective than metformin therapy alone without the lifestyle modification. So we need to have the thorough physical examination. We need to look into the height and the weight and the BMI. And for the children, if they are affected with diabetes, there can be arrest of the pubertal development and the growth in the children of the adolescents. For example, in children with type 1 diabetes, if the sugars are not under control, or else if they have some other risk factors, we need to look into the growth and the pubertal development in children and the adolescents. We need to also look at the blood pressure because diabetes is associated with many other diseases. We need to have the retina checkup. Once you develop diabetes, it is very important to have your retina checkup at least once in a year with the eye specialist. And if you have type 1 diabetes, you need to also look into your thyroid status. And then we need to also look into the skin, as I mentioned, acanthosis nigricans. It is a potential, it is a clear sign of insulin resistance, which tells us the future, which tells us the possibility of the future development of diabetes. And then if you're a diabetic, you need to look at your foot, visual inspection of the foot every single day and screening for the peripheral pulses, whether the blood circulation to your leg is appropriate or not. These are some of the things that need to be checked, evaluated. Now, laboratory evaluation is also important once you are diagnosed with diabetes. Apart from the routine checking of the sugars, you need to check your glycosylated hemoglobin at least once in 3 months. That is very important. And we also need to check the lipids to see how the cholesterol, the bad cholesterol level and the good cholesterol levels are. The liver function test. And we also need to check the urine for the protein leak from the kidney. Remember, diabetes can affect the multiple organs of our body. The earliest way how we can diagnose whether the diabetes is affecting your kidney or not is by checking to see if there is a protein leak from the kidney by checking urine for albumin creatinine ratio or the urine for albumin, urine for microalbumin. And so you need to check the serum creatinine. And if you are taking the molecule called metformin for long period of time, there is a possibility of vitamin B12 deficiency. And if you are on any medication, for blood pressure, specifically AC inhibitors or the ARBs like the ramipril or the lostat and other trinitrottan, you need to check your potassium levels also. So this is the laboratory evaluation that needs to be done at baseline. And also, at least once in a year, especially your kidney functioning test, serum creatinine, and the urine for microalbumin, liver function test, and your cardiac evaluation. And also, your HbA1c at least one minimum of once in 3 months' time. Now, after the laboratory evaluation, we need to be mindful, about the medical nutrition therapy. Now, diet, it plays a major role in the management of diabetes. Management of diabetes is not with medication alone. Diet is also equally important. Your exercise is also equally important. So we need to be mindful about the dietary modification when you have diabetes, or else pre-diabetes, or else if you are in the overweight or in the obese category. Now we need to move from each habit to key habits. Each habit is basically we eat whatever is ready for us. And then when you put on weight, then you think of lifestyle modification. But we need to think the other way around. We need to flip it around. We need to think first what we are eating, how much portion we are eating. We need to eat healthy and then we need to be active. So we need to change our paradigm, we need to change our thinking. Eat, act, and think. So we need to think first what we are eating, and then we need to act. Now, when we think foods, it basically has carbohydrates, proteins and fats. The way how we prepare matters to us. For example, if you take green salad, it is excellent and it's good for your body. But at the same time, the way how you prepare it, it goes from green to red zone. If you take the same green salad and mix it with mayonnaise and some other creamy stuff, then we put that same salad in red zone that it is dangerous for our body. We eat too much of that. Okay. For example, steamed rice is good, other hard-boiled rice is good. But if you're eating the fried rice and the biryani, we are adding so much of saturated fats and the caloric content is also increasing. So that pushes the same rice into the red zone. Okay. For example, whole wheat grain or the multi-grain bread is good, but croissants and cakes that put the same bread in the red zone. So you can look at this one. Where the foods that are in the green zone, they become yellow, or else in the red zone. It all depends upon the way how we prepare these foods. Grilled chicken, green zone, pan fried, yellow zone, but the same chicken, if it is prepared in a different manner, butter chicken, it puts that in the red zone. So we need to be mindful the way how we prepare our food at home, okay? And we need to be mindful about that one. Now, what is the dietary recommendation? Generally, the carbohydrate content should be around 45 to 60%. Dietary fiber, 25 to 50 grams. This is very important. We need to take lots of fiber because when you take the carbohydrates along with the fiber, it delays the absorption of the glucose into the body so that there is no sudden spike of the glucose in our body, and it also decreases the incidence of the colorectal cancer. Fats, it should constitute around 20 to 30%. The saturated fat should be less than 7%, and the polyunsaturated less than 10%, monounsaturated around more than 10%. Protein should be 10 to 20%, and the salt intake to be 1500 to 2300 milligrams per day. Okay. Now the healthy eating plate should be something like this. One half of your plate should be with vegetables and fruits. Okay. Now, if you are a diabetic, you need to be mindful about the food that you are taking. So at least in that 50%, around 35% should be with vegetables. Now, when I talk about the vegetables, we need to be mindful. If you're having diabetes, if you're overweight, if you're having pre-diabetes, it is preferable, it is good to eat the vegetables above the ground level. You can eat the vegetables above the ground level as much as you can, as much as you want. All the greens and then the eggplant or also whatever the vegetables that are above the ground level, they don't have much of a calorie. They have good amount of fiber. They don't have much amount of the carbohydrates. So, but the vegetables below the ground level, your roots and your tubers, like the potato, beetroot, and all those things, they are very much rich in carbohydrates. So, vegetables above the ground level, you can eat as much as you can. And then, so vegetables and fruits should be 50%. And the other 50% should be, half of whole grains and the half of healthy protein. What do you mean by healthy protein? It is better to avoid red meat, cheese, bacon, and other processed meats. Though these come under the risky category because they have lots of saturated fat and they are not good for our heart and for our health. Now, whole grains are preferable. When you talk about the carbohydrates, it is better we take the food which have a low glycemic index. For example, millet, foxtail millet. Now, millet have less glycemic index. If you want to eat rice, look at the type of rice you take. Brown rice has less glycemic index one compared to the white rice. So we need to keep this in mind when we think about the carbohydrates. How about the nutritious sweeteners? Is there any difference? The nutritious sweeteners include fructose, honey, corn syrup, molasses, fruit juice, dextrose, sorbitol, xylitol, and sucrose. Research has shown no significant advantage, or disadvantage of any of these over sucrose. Okay, so nutritious sweeteners as a form of sucrose or fructose, doesn't give you any advantage. If you have diabetes, there is no harm in taking artificial sweeteners. They can be safely used, and the Diabetes Association worldwide they have recommended that one. How about the exercise? The recommended exercise is minimum of 30 minutes per day. Okay, at least 150 minutes of exercise per week is recommended if you have diabetes or if you are overweight or obese category. Now remember the amount of energy expenditure on various physical activities. If you look at if you cycle 15 kilometers per hour, okay, you will burn 360 kilocalories. Okay, so but remember, we need to be mindful how much calories that we take. For example, if you take, maybe samosa, big samosa, or else if you take, a puff, chicken puff, or that has approximately 300 calories. Or else if you take one pastry cake, that has approximately, 300 calories. So remember, if you have to burn that many calories, you have to cycle at least 15 kilometers per hour. So this will give you how many calories you'll be able to burn with your exercise. Remember, 10% weight loss, it can reduce the risk of diabetes by 50% if you are having pre-diabetes, others you can overweight category. Diabetes-related deaths are decreased by 30 to 40%. Your 3 months average glucose will reduce by 15%. Your good cholesterol HDL will increase by 8%. Your bad cholesterol LDL will decrease by 15%. Your fasting glucose will decrease by 30 to 50%. Your blood pressure, the diastolic blood pressure decreases by 10 millimeters of mercury, and it also decreases the insulin requirement in case if you are taking insulin. So there are so many advantages with weight loss, and therefore you need to keep it in mind, and you need to be proactive to reduce your weight. How about the medication? There are different kinds of medication. I'll not be talking about this one, but I think you need to see your doctor. Your doctor will be able to look at your BMI, or your doctor will be able to look at your lifestyle. Based on those things, they will decide about the medication. And we also have insulin and other injectable medication like the GLP-1 analogs. Now there are so many myths about insulin. Okay, insulin means end-stage. Insulin causes kidney failure or the organ failure. Insulin is dangerous. Remember, it is not the insulin which will cause the organ failure. It is not the medicine that you take which will cause the kidney failure. It is the uncontrolled sugars that cause the organ damage. Maybe your kidney failure, or else your retinopathy, or else diabetic foot. So the basement thing is to control the sugars. Keep the sugars under control. That is very, very important. How you control it depends on it is either by lifestyle modification, the diet and exercise. If it is not possible with the lifestyle modification, then you need to be on medication. If it is not possible with the lifestyle modification and the oral drugs, then you have to be on insulin. So taking insulin is not dangerous. In fact, it is good if the sugars are not controlled with the lifestyle modification and drugs. So what are the targets that you need to maintain in diabetes? Your 3 months average sugar should be less than 7. Of course, this will differ based on the subcategory. Like if you have heart disease, it is better not to keep the sugar under tight control. Or else if you are elderly, it is better not to keep the A1C less than 7. Because if you try to keep the A1C, the 3 months average sugar less than 7, there is increased risk of developing hypoglycemia. And how about your cholesterol? Your bad cholesterol should be less than 100 LDL cholesterol, sexual cholesterol should be more than 40, and triglycerides should be less than 150, and your blood pressure should be less than 130 by 80. So, what are we aiming at? Our first target is to prevent the onset of diabetes or delay the onset of diabetes as much as possible. Okay, but if you have diabetes, our basic target, our basic goal is to prevent you to develop the complications. Okay, so if you keep the sugar under tight control right from the beginning, you'll be able to avoid or delay the onset of the complications because of the diabetes. Diabetes can affect your eye, can cause retinopathy, can affect your nose, can cause diabetic foot, can affect your kidney, cause kidney failure. It can affect your heart, causing the heart disease, can affect your brain, causing the stroke, can affect your peripheral vascular disease, can cause peripheral vascular disease, where there is blockage to the blood circulation, can cause gangrene and ultimately the amputation. It can also cause atomic complications. Okay, I think so. My intention, my desire, for the school children, you need to look into your weight and look at your lifestyle. And you need to look at, in case if you're having any of those risks, the focus should be on prevention or delay in the onset of diabetes by lifestyle modification. You need to think, then eat healthy, and then try to be physically active. But in case for the fathers, in case if you're having diabetes, maybe within the family or else your relations, it is very important you need to have a thorough evaluation. And then dietary modification, exercise, medication, and then monitoring because it's a dynamic disease. The drug that is prescribed today may not control your sugars down after 3 months, 6 months, and therefore it is important for you to follow with your doctor so that the dose can be titrated and ultimately will be avoiding or delaying the onset of complications. Thank you very much, and thank you, Clarence School, for giving this opportunity.
Thank you, Doctor, for reminding us to exercise and stay fit and be healthy, which will prevent and control diabetes. So eat well and be active. Thank you, each one of you who have logged in to attend this webinar on diabetes. So let's change our lifestyle, stay healthy and stay safe. Thank you.
Thank you, Madam.